So I'll start with a bit of a presentation, and then I'll come to our three panelists. And as I go through the presentation, I'll get to our model quite quickly, and you'll see how the model's set up in three sections, which then kind of defines the shape of the conversation we're going to have today. So I'm just going to share my screen, and I'll be coming to our speakers in no more than 5 minutes to put you to warn you. So share screen, PowerPoint, and right, everyone seeing that? Great. So basically what we've done is, I want to say this, in some ways there's nothing new in this report. What we've attempted to do is synthesize the knowledge that's already out there and put it into some kind of format which is easy for people to understand and digest. So for those who don't know, the Australian Men's Health Forum is the peak body for men's health in Australia. We've been around in different ways for about 25 years and date ourselves back to the first National Men's Health Gathering in Melbourne in 1995. And from that, I'm sure if you've got more time with people like Greg and other colleagues who aren't on here today, they'll tell you the whole history of how AMHF emerged. But basically, eventually, from these gatherings of people who are concerned about men's health, an organisation was formed and was for many years voluntary. But has always aspired to be a peak body that either represents people working to improve the lives and health of men and boys, and or men and boys themselves. And today, the Australian Men's Health Forum, now funded by the Department of Health, represents a diverse membership of people working to improve the lives and health of men and boys, but also tries to give a voice to, maybe not to men specifically, because we don't have the mechanism for that, but certainly a voice to the issues that men face in society. I think that would be a fair and reasonable way to say it. So we advocate for action on the issues that impact men and boys, and we represent organisations who are working to provide some solutions to those problems. And so part of being a peak body is about carrying the knowledge forward, because one of the frustrating things that you often see is from time to time, some people will start to focus on a project to reach men, and will start to have conversations from scratch, which certain people in the sector will look on from a distance and go, either they're starting in the wrong place, or they're not building on the knowledge that's already there. And that's not their fault, because the knowledge hasn't necessarily been made available. So part of what we're trying to do as a peak body is bring forward the knowledge that's already been accumulated and make it available to as many people as possible. So firstly, why do we need male-friendly services? And people talk about man-friendly services, male-centered, gender-specific. There's lots of different language. We're just calling it male-friendly, but it can be any of those things. And I don't need to tell people here today, I'm sure, men generally have poorer health outcomes. For example, in Australia, men die 6 years younger than women on average, and most of us will know about the stark suicide statistics, with 3 and 4 suicides in Australia being men. And yet men are generally less likely to access a broad range of services. Or, put another way, services are less effective at reaching men. And in the world of health, there is a large focus with population groups on saying, don't ask why people aren't accessing your service, ask why your service isn't reaching those people. Don't try and reorientate people to the way you deliver health, reorientate the way that you deliver health to those people. Or, as one of our members who works in rural Australia, Mary O'Brien from RU Bogmate, said in one of our meetings a couple of days ago, calling bullshit on the idea that men don't get help. In policy language, we call that reorientating services towards men, and that's now recognised internationally as something which health services should be doing, and it sits within the National Men's Health Strategy, which says that it calls for all levels of government to be delivering services in ways that are male-centered, whether that's information, whether it's programs, whether it's services, and that services, it says that services should be consciously considering the specific needs and preferences of men. So from a policy perspective, this is what the government says we should be doing. but it isn't always our starting point when we look at how do we make sure services are working for men. Just some broad sort of general rules here. There's definitely no one size fits all approach. Whether it's biological or socially constructed, whether it's nurture or nature, it doesn't matter. I don't personally care, but we all know from our lived experience there are clear differences between men and women. But there are also differences between different groups of men as well. So for me, a male-friendly service is about working with some of the archetypes of masculinity, but also going beyond stereotypes and supporting emerging masculine strengths. So not just sort of rigidly stereotyping men and saying, right, okay, we need to reach blokes, we need to do something with football and beard because that's what blokes like, but also really actually recognizing where men already are and what men are already doing. That's a strengths-based, asset-led approach, but also allowing for the fact that we all grow and evolve, and new ways of being a man, new ways of expressing masculinity can emerge. When at different times in a man's life, and crisis can often be, from my perspective, that shouldn't necessarily be the first priority of a service. If your service is to reduce weight, for example, your first priority should be how do we help blokes reduce weight, not how do we change blokes' sense of identity in order that they can lose weight. But that's open to discussion and debate in terms of how best we approach working with men. So this is the model we've come up with. Basically, it attempts to bring together all of the, I think I froze there for a moment, bring together all of the key features that we find in research and practice when it comes to male-friendly services. And we've broken them into three areas. One is just basically how you promote services. One is the culture of the service you deliver, and one is that broader structure, the structure of the system that you operate, even from how your intervention is designed right out through to the kind of like the broader social structure and the government frameworks and policies. So we're going to have 3 sessions, and each session is going to focus on one of these areas. And so this morning, we're going to look at the promotion piece. The 3 aspects of promotion. One is that, so what we've done in here is said, what are the common characteristics of services that seem to be really good at reaching men? Well, they target men directly, they meet men where they are, and they use male-friendly language. So that could be in the actual promotional materials in terms of targeting men. It could be in the places where the services are offered, like workplaces, public barbecues, sports clubs. And sometimes it's just about taking an existing service and actually putting a male focus on that service. And then this kind of stuff's been known for years in the men's health sector, just basic stuff like being available outside 9 to 5, or being around at the weekend or the evening, or outreaching and taking services to places where blokes already go. And then language is a massive thing that comes up. And we can have a big discussion about what constitutes male-friendly language. What's male-friendly language to me might not be male-friendly language to you, but there's definitely something in the way that services and individual service providers actually talk to men and interact with men, which shows up in services that are really effective at engaging with men. And sometimes that's right through to using quite strong kind of like blokey metaphors like vehicles and sport and all that kind of stuff. So that's the model. And for this morning, we're just going to look at that whole piece around, about language, around targeting men, around meeting men where they are. And to have that conversation with me, I've asked 3 people to join me, and I'll explain why I've asked them to join me, and I'll ask them to then introduce themselves. So I'm going to give you 1 minute each, guys, to introduce yourself, but let me introduce you by explaining why I've invited you. So Brad Butt is from a pharmacist called Men's Health Downunder. As far as I'm aware, it's the only pharmacist service that specifically targets itself at men. It's got quite a funny name, Men's Health Downunder. Do you get the pun? and it's clearly doing some of this stuff. So, Brad, do you want to take a minute just to introduce yourself and tell us a bit about your service? And I'll stop sharing the screen as well so we can see your face. You need to just knock your mic off, Brad, or not on, rather.
Yep, I'm there. Yes, I'm Brad. I'm a pharmacist that works for Men's Health Downunder. Men's Health Downunder is run by pharmacists to help men with their urological health needs. So that might be anything from erectile issues to help after they've had prostate cancer, Peyronie's disease, which is where they get a bend in their penis, continence, and inevitably, when you put the patient at the centre of they're the primary focus, other things come up around mental health and general health and well-being as well. So, weight loss and diabetes and cardiovascular health. So that's us. We're based in Canberra. We'd see probably about 1,000 patients annually from all over Australia. A lot of it's done like this online, and we've started seeing the odd patient from New Zealand as well. So that is us, and it's counselling, medication provision, and general advice for men.
Brilliant. And I don't know about anyone else, but I winced a little bit when you talked about a bend in your penis. That just, I don't know what it was, but it just made me go, oh, I shuddered a little bit there. So good to have them. We should have had a trigger warning on your introduction, I think, Brad.
More to come.
I'm sure there is. So yeah, thanks. I mean, awesome work that you're doing, and looking forward to hearing more about it. So our next guest is Jonathan Bedloe. Jonathan's been around the men's health sector for many years. On my first trip out here in 2013 to the Men's Health Gathering, I met Jonathan then, and then when I got the job at the Australian Men's Health Forum, he was my boss. He was Mr. President, El Presidente, and we had our Monday morning calls every week, and I'm sure he's pleased not to have to talk to me every Monday morning these days. But Jonathan now has got a wealth of experience, and really that's why I've asked him, because he's got a wealth of experience, and I can't pick one thing. Jonathan, you've got a wealth of experience. Do you want to introduce yourself, because you'll do a better job than I will?
Thanks, Glenn. Look, great to be here. I miss those Monday morning catch-ups, that's for sure. But look, I started my interest in men's health and wellbeing through starting a men's shed. I got a job where I was sort of nominated to be a person to run some men's health programs or men's programs. It included a men's shed, and I was very lucky that day 2 of my job was actually day 1 of the first National Men's Shed Conference in Lakes Entrance. It was a real eye-opener, and made me, I suppose, really helped me become quite passionate about the whole issue. So since then, and part of the key thing with running that men's shed was I had no support. How do we as blokes engage with other blokes? And nobody could really tell me how to do that. Yeah. So it started a bit of a journey in that space, and since then we've started Men's Resources Tasmania, which is where I'm lucky to be partly employed now.
Excellent. Thanks for being here. Looking forward to your words of wisdom and insights. And our third guest then is Michael Whitehead. I know Michael least of the 3 guests, but when I was sort of working out who should we bring into this conversation, and I looked at this section, and it's the whole piece about targeting men directly, and it's a truism in the men's health sector. When you talk about men's health, you go, one of the things, waiting rooms are very feminine, most literature is targeted at women, and we just sort of take it for granted as a truth, but it very rarely gets examined. And I noticed that Michael had actually done some research where he'd done the job of actually auditing literature in health settings, and I thought, oh, that'll be an interesting person to get along and join this part of the conversation, because he's not just taking it for granted, he's actually testing the thesis, and the reason he's testing the thesis, I believe, I don't know, but I believe it's because he's passionate about men's health, and I've seen his name around for a few years, but I'm guessing that interest comes from a passion and a commitment to improve the health of men. So I'll allow him to introduce himself. Michael, good morning. Thanks for being here.
Good morning. Thank you for having me. So my name's Michael. I am a nurse in Sydney. I work as a clinical nurse consultant in between the hospital and community. I got interested in men's health a number of years ago. I am a father of 4 boys, so I guess it was slightly inevitable. I commenced some research which hopefully will be published later this year, where we looked at the amount of men's health literature in health facility waiting rooms. So we only did waiting rooms that were linked directly to public health, such as GPs, hospitals, community health centres. And we found some quite stark statistics that men's health literature was the most underrepresented of both genders and of gender neutral. So thank you, Glenn, for having me. I've done a little bit of work in the men's shed space around an education program, which Glenn might know of, and yeah, thank you so much for having me.
Right, no, thanks for being here, Michael. So, Brad, I'm going to come to you first, but before I do, I'm just going to pop the model up again, and I'm going to ask you to speak about how your service works and what the logic behind it is. But also, as you're doing that, see if it relates to anything that we're sort of highlighting here. So let me just pop the model up again just for a second. So we're looking at the promotion piece. Now, one thing I want to say about this model is it's not like 3 completely separate siloed areas. A lot of the principles are overlapping, and a really good example here is meet men where they are. Now, in really obvious terms, that's like going to a male-dominated workplace, or a pub, or a sports venue, or it could be, through technology on their smartphone, because where they are is holding their smartphone. So it's physically meeting men where they are, which is important in terms of promotion. But also it can mean emotionally and psychologically meeting men where they are on their psychological journey. So it's kind of like, the example I often give is working with separated fathers. Don't expect separated fathers to turn up and want to have a conversation about how they're emotionally impacted by the situation, because where they're at 99% of the time is dealing with the stress of the situation and trying to work out all the practical stuff. And so then if they come in asking for practical support and then you try and give them emotional support, you're then at odds. You're then coming from 2 different directions. You're not meeting them where they're at on their journey. And what we find is if you actually meet them there in their anger, in their frustration, in their need for practical support, that actually the opportunity to do the emotional work comes later. So when we talk about meeting men where they are, it's not just about in the physical space. So targeting men directly, meeting men where they are, and using male-friendly language. So back to you, Brad, for a few minutes. How does your service work? And can you see that? Which of those principles do you feel you're applying, or maybe they don't resonate with you? You tell me.
Thanks, Glenn. Look, I think it would be fair to say that I think all of those areas are fairly relevant. The targeting men directly was probably the cornerstone for our program, because we needed to get those men through the doors to come and see us or online. And for us to target the men directly, and it might sound crude, but the motivating factor for most of these men to talk to us was the health of their penis, to be honest. And I think, as a lot of the men can probably relate to sitting on this conference now, if for no other reason but to have my penis work and for me to be able to feel confident in my ability to get an erection or to be able to satisfy a partner, it was pretty motivational for them. So I guess, particularly for the men that have had prostate issues, one of the questions that comes up is, what about my erectile function? I'm now survivorship. The cancer's been removed. I'm otherwise pretty healthy. What about my erectile function and continence? And that tended to get men through the door. So to be able to target them on that level, I think, was important, and probably a little bit perhaps cunning, I suppose, but an important way to get them in and get them talking about their health. Because as we all know, erectile health is, it's a combination of more than just more than just what's happening down there. It's about emotional health, weight, your weight, your blood pressure, etc. So beyond that, targeting the men directly, we had to go to the source where these men were being found. That's our primary source for referrals. So going to their urologists and saying, hey, we're available, we provide this service, this is what we do, and we work primarily with men. And I think for the urologists and GPs out there, they're at a bit of a loss as to how to manage a lot of men as well. So the fact that we were able to provide them with a service that they could refer to was really valuable to them. And let me just say, that goes beyond GPs and urologists, actually allied health. And I know there's a few allied health practitioners sitting in today, psychologists, physios, nurses, etc. In terms of the men, in picking up the men where we could, where they were, and I think there's other groups that do it well with barbecues and being out in social settings. At the pharmacy, we have probably 40% of the patients come through the door are male. Often the female is the main healthcare provider, but we get a lot of men coming through the door. So it was about taking the opportunity when they come in, not to engage them in a chat about sport particularly, but let's talk about how they're traveling. And that could be anything from mentally to cardiovascular to erectile to whatever. So I think that was really important as well. And in pharmacy, we talk about this grey space where you're not necessarily talking about anything important, and moving from a grey space to a chat about health. And I think often health practitioners miss that point. We're very quick to talk about things we're comfortable with, but not the things we're uncomfortable with. So teasing that information out of them. Certainly the emotional point you made, Glenn, I think is really relevant. The men that we see that have had prostate cancer, it changes their life. And for most of these men, they've been well, and being able to build that relationship pretty quickly with them was important, and being able to show empathy and show them that we understand where they've come from. We understand their life's been flipped upside down, but there are avenues that we can go down to help them. I think was really important. So being able to tie that emotional conversation into what we're doing was really relevant and important as well. I can't remember what the third one was in your wheel, Glenn. What was the third one? I didn't have a chance.
Targeting men directly, meeting men where they are, and using male-friendly language.
I mean, male-friendly language is obviously important. In pharmacy and medicine and allied health, we're probably pretty quick to talk technically, but we need to dial it down. Although that said, we've still got to be respectful of the men, because a lot of men are educated and are able to have a fairly high-level conversation about their health. So I think it's important to keep the language male appropriate in an allied health sense, but equally, I think we need to be confident that men are educated and that men do understand the health, to a fair extent, particularly the men that we're dealing with, and not to dumb it down and make them for risk of making them feel silly. Yeah.
Yeah. So I guess the point there is about having an awareness of how men in general may communicate about this stuff, but then also tailoring that to the individual to make it person-centered underneath all of that. Yeah,
I think look, humour is a really interesting thing, and I think it's very valuable. Men tend to enjoy just a little bit of humour, and I mean, even something as scary as cancer can be, it's nice just to take a step back and relax and have a little bit of a laugh. I often say the blokes when they come in, because they've got to get a penis pump or they're doing injections into their penis, another wince moment. I think you need to bring your sense of humour along, because this ride that we're going on, and all men are going to go through health challenges. We do need to have a little bit of a laugh at times, because if we didn't laugh, we'd cry, and I think it'd break us, some of the stuff we go through. Just on the importance of picking men up where they are, and I don't know how many people allied health, and I know that I've forgotten the other gentleman's name who's speaking. Keeping your workplace or the place the men are coming to, if they're coming to you, appropriate is really important. And in pharmacy, we had cosmetics and handbags and gift bags and all that sort of rubbish. In our pharmacies, we've gotten rid of all of that to make it more male friendly. And I think that's really important, because if we make our premises male friendly, they're more likely to come in. And I think we've seen that here in Canberra in our pharmacies.
That's excellent, Brad. And I'll just pick up on that humour piece. It's great to see that mentioned so early on. it's just something that comes up time and time again. And even in the places you wouldn't, I mean, we're talking about penises and pumps. It's you can't have that conversation with blokes for too long without humor coming into it, right? But that humor piece is not. It's not about the humor piece. Isn't about the penis. It's about a form of communication, because you'll find that humor in some of the most difficult situations. And I'll keep coming back to separated dads, because it's where I've worked the most personally. And you can be in a situation where guys are crying with distress, but also then crying with laughter within the space of a few minutes. And the skillful use of humor is something that we see time and time again with practitioners who are really effective at working with blokes. And it's an icebreaker. I think it creates a sense of equality. Can you teach that? I don't know, but it's good to acknowledge that the use of humour is a big part of can often be a big part of effective communication. But it doesn't mean dumbing down, right? It doesn't mean dumbing down. And I think something else I want to take from I think something else I want to take from what you said, Brad, and this is a point I want to emphasise all the way through today, is this is not, even though we're talking about male friendly. And obviously, that's a very binary thing, male-friendly and not male-friendly, or male-friendly and female-friendly. This is more complex than a binary conversation. So you were talking about, meeting men where they are while they want their penis to work. So that, and that could fit into a kind of binary notion that men want practical support and women want emotional support. And that shows up in the literature in lots of ways. You compare prostate cancer support to breast cancer support. You can find that sort of notion showing up. But it's not all men want practical support, and that's all they want, and all women want emotional support, and that's all they want. It's more subtle than that. And often they want both. They might just want it in a different order. And I find that, to re-emphasize the point I was making earlier, sometimes the way you build trust and rapport is showing that you can do the practical stuff first, and then the permission to do the emotional stuff comes second. And so it's not that men only want practical support but don't want emotional support. It's just about getting the balance right for that individual.
Glenn, I think the other thing that's relevant is the need. Am I unmuted? No. The other relevant thing is the need to involve a significant other if the male is comfortable and happy to do that. We see it time and time again, whether it's a supportive partner, and it might be a wife, it might be a male partner. And I think it's worth trying to engage those people in the conversation. Men typically will probably try and do it alone. And interestingly, in our pre-consultation talk, I'll always offer, if you've got a significant other you'd like to bring along, please bring them along. 2 sets of eyes and ears are much better than one. And it's amazing how often the partner will say, I'm so glad that I was able to come along. And equally, the male partner will say, it's been great having my significant other with me. Because I think it's important. It's a journey that they will go on together. And in Glenn's, your situation with single dads, if there is somebody else that they can get to come along with them, I think it can make the world of difference.
Yeah, great, really great insights, Brad. Thanks. I'm gonna move on to someone else, but we'll bring you back later in the closing session. Jonathan, I don't even know where to start with you. I'm just going to give you an open goal and say, tell us how you see these principles being applied or not applied in the work that you do.
Thanks, Glenn. So, look, I love this model. I think there's some really great summary points here. And I think actually the model itself, in a way, is walking the talk of some of what you're saying, keeping things simple, keeping the language clear and succinct and summarising. And I think that the model kind of does that and shows a way to do that. So for us, Men's Resources Tasmania, we set out when we incorporated 5 years ago. We've been sort of operating as an informal group for a long time before that. But when we incorporated, we were thinking quite carefully about the name, and part of it was I was inspired by by Grant over in Western Australia, Grant Westhorpe, who has Men's Resource Centre. And I thought that idea of resources, was really powerful. And also getting away from health, although we might be trying to share positive messages around health for men, perhaps, and obviously there are times and places where that's central and we need to use those words. We wanted to look more broadly than that and come at it in that sort of more cunning way that you mentioned, Brad, about sort of just coming in a more subtle approach. So that's where the Men's Resources Tasmania idea came from. It also abbreviates nicely to Mr. Tasmania. Nobody's kind of really gone with that, but that was, that's where I would have liked to have gone. And then also, so one of the main resources we've created at this stage, although that's what we've called ourselves, a lot of our work has been more around advocacy and trying to provide a male voice into policies and forums that are happening. So we haven't been so much a service delivery organisation. We're probably moving towards that. But the key one is the Blokes book. And I've got a link here, which I'll put in the chat, which we stole from the Benevolent Society in New South Wales with their permission, of course. But we took what they had created and designed it up to fit the sort of the Tasmanian context. And so the key thing with that is about using language, putting information in a booklet that's tangible, that's quality, that's accessible. So it's a sort of thing that goes in, we've heard, that goes in the glove box of the car. It's been put on, in their tea room at various male workplaces. And so we've been able to target men in that way by focusing on the workplaces. One of the challenges I've had with this particular booklet has been, everybody says how fantastic it is, but everybody that I'm in touch with are mostly female workers, whether it be nurses or counsellors and the like. So a lot of the people who've distributed the books have been women, and that's where I've heard commentary from most. And I sometimes worry that it's meeting their need to provide a male-friendly resource. Is it actually that great for the men who are receiving it? I think we can be fairly confident it is, but it's just an interesting tension in there, I think, between those two things. And I guess we've tried to use positive branding, positive messages. One of the areas of discussion in the booklet is around violence, and there's a lot of pressure for an organisation like ours to try to counter the violence issues from both perspectives, in terms of pushing language and challenging men to behave better. But then on the other hand, we might get pressure potentially from men to say, well, what about all the other aspects of masculinity? So how do we manage that dance? So we intentionally put in a page which addresses male violence and connects people with those resources, but then we also had a page around male experience of violence, and we put that first so that we're acknowledging that males experience violence, as we know, in great numbers in outside the domestic violence space as well as within it potentially. So trying to be inclusive, trying to be open to the different perspectives, I guess, has been an important part of what we tried to do. Great,
thanks for that. So I'll move on to Michael, but we'll come back to you in a second. The Blokes book's a really nice example of actually someone sitting down specifically and thinking, how can we communicate this more effectively to men? And it'd be really nice, a really nice point to come to Michael to in a moment. And considering the budget you have to do that, Jonathan, I think it's an incredible resource. And just imagine what you could do with if you had $100,000 to do communication with blokes, building on all the kind of the branding and the kind of the knowledge that you've already got within it. And we get people asking for a version. Is a version in Victoria? I got an email just last week. Is there a version in New South Wales? You know, and there's not right now. So it's, yeah.
Can I just add, can I add as well that one, you know, in this digital age, there is a little, you know, there is thought: do we need practical or physical booklets? And I think, certainly in Tassie, we definitely do. You know, we heard the other day from Barry Golding from Victoria that the literacy rates for men over 70 particularly are massively high, or illiteracy rates. But there's so many men in, you know, geographically remote places where they maybe don't have the internet, or they don't have that technology focus. And so, yes, a practical resource, I think, is still really valid as well.
Yeah, I mean, totally agree. And you can do both, right? It's not it's not an either or with this stuff. I just want to pick up on the violence piece a little bit there, because that sort of acknowledgement that that being a perpetrator isn't the only experience of violence that men have, and if we only push that message, then we alienate men because we're not acknowledging the wealth of experience. And I'm reminded of a piece of work I did in the UK with a charity working with male survivors of sexual abuse, and this goes down to the sort of targeting men where they are piece, and they came with like a budget of about $20,000, £10,000, and they were going to spend it all on putting adverts by football grounds to reach men, because they knew there were more male survivors of sexual abuse than they were reaching. Now, in a very simplistic way, that would be an example of targeting men directly, but I pulled them back and I said, well, where are the men you're trying to reach? Where are they? Because what do you already know? They said, well, they get referred from GPs sometimes, but more often they get referred from alcohol services or homeless services, or from from prison services, because they haven't dealt with the sexual abuse as a child, and they've really messed up their lives. And it's only when they get to a point of crisis that the fact that they were abused as a child came out. So we'll say, well, they're probably not going to the football match so much. So maybe you just want to elevate what you're doing. So all we did was we targeted stuff at GPs, and we did some public events where we got people working in prisons and homeless services and alcohol services to come and talk for a couple of hours about male victims, how to look out for male victims of sexual abuse. And we doubled the referral rates into their service. And we did it for a couple of $1,000 rather than $20,000. So we need to be wary of sort of like tokenistic or glossy campaigns, because they don't always work. Sometimes it's reaching out to where men are. In this case, having a conversation with their GP, or having showing up with problems in other services. But to come to you, Michael, I think you can take this conversation where you want to take it, but I am first interested to hear from you about where it doesn't work. So where we're not targeting men directly because of the research that you've done. But you can take this out. You can go wherever you want with your say 5 minutes.
No, that's fine. I'll address the 3 points you had in that great graph. So when we talk about targeting men directly, I think Brad had a really good point. And what I want to bring it back is that are our facilities displaying that we are male health friendly? So iconography is the official title of it, and there was a great research done in the 1980s, in the 80s and 90s during the HIV/AIDS crisis, where GPs in a particular part of Sydney really wanted to reach men, not just gay men, but men who had sex with men. They used icons, a simple symbol as the rainbow on the front door, made other men feel safe in approaching it. They knew that there was going to be no stigma, no judgment by either the reception staff, nurses, doctors, what other practitioners were there. Those simple gestures are what we are finding in our research now is not actually being done. We know that there is an argument, build it and they will come. We know that men do engage with health. The latest statistics of Medicare services through the Australian Institute of Health Welfare show that females engage 19 occasions per year, men engage 14. Men are not that far behind. Why that doesn't translate to healthy outcomes is, I think, the battleground. Whether what we are trying to teach with health professionals is to use what we call opportunistic conversations, and Brad was alluding to that, so that if a patient comes in with diabetes or has been diagnosed with diabetes, we start the conversation about, do you know that impotence has a 50% chance of happening with diabetes? No, we're finding not. A lot of health groups are really promoting this at the moment. Healthy Male Australia is sending a lot of literature in that direction. The other important point I would make finally is to use male-friendly language. Know your audience. There are times when you can drop the F-bomb with blokes or other workers in the field, and it's entirely appropriate because you're speaking the language of your audience. I ran a workshop on men's health to palliative care volunteers and palliative care wives of men who were dying. There is no way I would use that language, but they all wanted to talk about sex in that. And it threw me for six that a whole lot of women with husbands who were dying wanted to talk about sexuality. So being mindful of your audience, using language that's appropriate, and particularly with our Aboriginal Torres Strait Islander brothers and our CALD community, sensitivity, understanding men's business, particularly if you're a female practitioner in men's health, just that mindfulness. But yeah, take-home message is promote, use icons in your workplace, show that you are a male-friendly practitioner. Thank you.
Great. Thanks for that, Michael. Really fantastic contribution. And Brad, I'm reminded there of the signalling that your service is male-friendly of the GP's clinic, the man cave GP, the man cave clinic in the States that we were sharing about a while ago, where the entire sort of clinic was like a big sports cave.
Just unmute. Yeah, that's right, Glenn. Yeah, and I suppose our suite here in Canberra, because we set up our own little private suite, has tried to replicate that, less the alcohol and probably not so much sports dominated. But yeah, look, you've got to have a nice male feel about it, I think, and masculinity to everyone is slightly different. I think people get confused between masculinity and being a man. So we tried not to make it too much like being a man, but just nice masculinity feel. Yep, really important.
Right. Yeah, I'm just going to post a link to the Man Cave Health. I mean, I'm not suggesting for a minute that every single health service should be like this, but it's a really nice example of taking the male-friendly signalling to its biggest extreme. So we've got about 6 or 7 minutes. I'm going to throw it open to the floor. Easiest way to do this is click on the participants icon at the bottom of the Zoom window. So wave your cursor over there, find the participants icon, and then when you click on that, a window comes up in the top right-hand corner with a bunch of names and some icons as well. And one of them is a blue hand facing upwards. So if you can click that, if you want to actually make a contribution to this conversation, either to share some experience yourself or to ask a particular question, or you can wave a finger. You can wave a real finger like Greg's doing as well. I can see your real finger, Greg. But I'm also encouraging people to use the icons. Getting no blue hands up. So over to you, Greg.
Yeah, thank you. Great presentations. Just a quick one for Brad. There has been some research done over 20 years ago up here at the Newcastle University by Richard Fletcher about men and chemists. And if I can dig it up from somewhere, I'll send it to you. But one of the points he made in that is when men go into a chemist, they go to buy something. When women go in, they shop. So I was really pleased to hear that you took all the girly, womanized things out of your chemist shop and took them away, because they don't interest men at all. Men go there to either buy something, to fix something, and extending to what you're doing, have a chat with the chemist, because I think chemists are obviously, frontline healthcare workers. I have a great chemist here that I have a good relationship with. So thank you. I think you're doing great work, but you've picked up that thing that get rid of the handbags and scarves and stuff. Thanks.
Great. Thanks, Greg. I'm going to go to a couple of other people. We've got some hands now. Tim Landy, I think you had a hand up. And then also Kate. Tim, you got something you want to share or ask? If Tim's not jumping in, Kate, can you jump in? Oh.
Yeah.
Hi, Rebecca. I've just
Hi.
noticed. Yeah, good. I'll come to you in a moment, Rebecca. Thank you. Kate, go ahead.
Hi, thanks so much for a great conversation, guys. It's been really helpful. I'm a PhD and psychology master's student from the University of Adelaide, and I'm doing research in men's grief when they lose a baby, so stillbirth or neonatal death and miscarriage. I'm really interested in this particularly from a pregnancy health perspective. I think traditionally this has been something that's very women focused, obviously, because it's such a involved process for women as opposed to how it is for men. And I think what we're finding is that we have a lot of support services for men, but they're just not accessing them. We're not sure why, but it seems to be particularly that men are sort of really engaged in this supporter role for their female partner and don't feel like they're sort of able to seek support for themselves, or feel like they have to, like you said, Glenn, be involved in the really practical things straight after a loss rather than their emotional needs. So yeah, just open question topic of conversation. I think if you have any perspectives on how we can make pregnancy services and supports more attractive for men in that space as well.
Great. We've got Andrew King. If you're here for the whole day, Andrew King in the session at 12:15 is our man in terms of family father friendly stuff. So if you can stick around, we'll bump that question up to then. And Jonathan's got a quick point.
Look, yeah. In response to that particularly, I would say just being really intentional to be inclusive, I think is going to go such a long way to validate and recognise the role. A few posters on the walls that acknowledge his role. When we give mums the blue book and all the paraphernalia that mums get too, let's try and create something for the dads as well. The other thing I wanted to say was the idea of permission. I think a lot of what we're doing with all these different things, with posters on the walls, with male-friendly spaces, is also about giving men permission, but we can do that in a more overt way as well, as in by inviting them into the space and acknowledging that we're going to keep confidentiality, that we're open, we're not going to be shocked by anything we hear, that we're not judgmental, we're respectful of the diversity and that sort of thing. So I think that idea of permission is certainly one that I've tried to keep in the background. I think once men, probably anybody, but once men sense that permission they've got to talk, they'll run with it.
Yeah, and great, Jonathan. And a quick point, which I'll expand on later, saying parents instead of mums is not inclusive, because parents is seen as being mums still. If you want to target dads, you have to say dads. That's something we've learned over the years. We're nearly at time, but Monumental Dan, you have had your hand up, and if you can keep it fairly precise, I'll come to you.
Yes, I just wanted to say that humour is such a valuable tool for connection, but it's also a bit of a gamble. Who's got any tips on how to deliver that without stepping over the mark?
Yeah, Brad, you've been talking pumps and penises all morning, so I think this is in your court, Brad.
Yeah, it's a good question. You can certainly go the wrong way with humour, but I think I don't know. I mean, if you speak to a lot of blokes, you tend to find pretty quickly you can get a gauge as to whether they're appropriate for it. And sometimes they'll drop the F-bomb, and you think, right, well, if you're away, I'm away. We'll enjoy this. But I normally just open by saying, it's worth having I hope you brought your sense of humour, because some of the stuff we're going to cover today, is pretty deep and meaningful, and like you've never probably talked about before. So I think that they'll often give you permission. I think that's a good way to start, is by seeking their permission in a fairly open way. So I think that's probably the easiest way to do it. You can tell if they're not up for humour, they will show you in their body stance, their facial expressions, their body language will often give it away. And maybe you have to save it for 10 minutes time.
Yeah, and that's great, Brad. And just to pick up on the word that Jonathan used about being intentional, I think we have to be clear what our number one intention is. our number one intention is to make a difference, not to make people laugh. And if you're trying harder for the laugh than you are to make a difference, then you need to have a word with yourself about your priorities. And I think, it's like, is humour going to make a difference for this bloke? Or is this just an opportunity for me to bring out my favourite 3 jokes that I like to do every time I do this interaction? So other hands up, but we're gonna have to, Jonathan, I'm sorry, we're gonna have to drop it in the comments box. No, Bob, sorry, not right now, but later you'll have a go, because we've got Dr. Rebecca McGowan waiting, and we're 2 minutes over time. So thanks to our 3 panelists. It's been a great start to the conversation. Thanks, Jonathan. Thanks, Michael. Thanks, Brad. You're welcome to stick around, but if you're busy and you have to go, totally understand as well. So we'll say our official thank you and goodbye for now.